us about your study.
So for this study, what we did is we went ahead and used the HealthFacts database, which is the Cerner database that takes 600 hospitals across the country in a HIPAA-compliant way. And what we were able to do is actually look at emergency room encounters for adolescents and young adults. We looked at ranges between 2010 through the years 2010 and 2016, and we were able to get over 14,000 encounters. And we were looking for the incidence of opiate use. What we found is about 23% of encounters for individuals that were going to the emergency room for migraine received opiates.
Wow, and this is for children or adults or older?
So this is for the ages 12 to 25. Okay. So we wanted to be able to look at not just adolescents, but to see how that compared as they got older. For example, is there a difference between how a 15-year-old is treated versus a 25-year-old? And we did actually see that as somebody gets older, they are significantly more likely to receive an opiate.
More likely to receive an opiate. Did you notice over the course of the study perhaps that in the earlier years there was more use of opiates and less later on?
There was, absolutely. So some of the predictive factors, because what we did was looked at what were some of the things that could predict if somebody was going to get an opiate or not. And one of it was when we started this study looking at the data at 2010 and then we went to 2016, that the closer they were till 2016, the less likely they were to get an opiate. Of course, that's when more of the education started coming out about the downsides of opiates and pain management.
So what do you think neurologists can do to educate our emergency medicine colleagues about managing migraine in the ER? Because obviously, you know, despite our best efforts, sometimes our patients end up in the ER.
Yeah,
so
absolutely.
What can we teach them?
Well, one of the things, I have a lot of empathy for emergency room docs. They get told, treat all pain with opiates, and then they get told no more opiates. I think that the most important thing is that migraines still require treatment. What I would hate to see is for someone to say, I have an opiate, I can't use it, so now I can't treat pain, which we've unfortunately seen in other fields. So one of the things that we've done at our institution, for example, is we have a clinical practice guideline and a Cerner order power set so that it doesn't have opiates on it, and we're able to decrease the use of opiates at our institution to less than 2% of emergency room encounters. So sometimes by not just education, but also helping to develop algorithms and power sets, you can really sort of back away from that urge to use opiates while also giving them a way to treat headaches.